Today we will discuss about the gluteal region. Here you can see this is the prone position of the body, and you can see this is a gluteal region. The both side of the gluteal region, this is the right side and this is the left side. The gluteal region, each gluteal region which is divided into the four quadrants: superior and medial, superior and lateral, inferior and medial, and inferior and lateral. Amongst the superior and medial quadrant, here there is a cutaneous distribution, skin innervations by the nerve supplied by the L1, L2, L3, as well as the from the natal cleft on the medial aspect near to the perineal region. This cutaneous distributions by the S1, S2, S3, as well as on the gluteal region on the inferior and medial quadrant, the cutaneous distributions by the perforating branches from the postcutaneous nerve of thigh, and it is also some of the portion by the S1, S2, S3. Inferior and outer quadrant or anterior quadrant, which is supplied by the lateral cutaneous nerve of the thigh L2, L3, and the superior and lateral quadrant, outer quadrant, which is cutaneous distribution by the subcostal nerve and iliohypogastric nerve. These are the skin innervations by the uh, over the gluteal region. Now I will keep the incision on the upper aspect of the iliac crest, and into the natal cleft or gluteal cleft we will into the midline we will take the incision. On the lower aspect of the perineal region around to the anal canal we will keep the another medial incision, and we reflect the skin of the gluteal region. So I will reflect the skin of the gluteal region. Again, over that you can see there is a fatty layers, and deep to this fat there is a gluteal fascia. It is more less thin over the gluteus maximus, but the another place is on the upper part and lower part. There is a gluteal fascia which is thicker. And now I will cut this gluteus maximus from the middle aspect, and I will reflect the gluteus maximus, and we can see the structure under beneath to the gluteus maximus. First of all, you have to identify. Here you can see this is the one ligament. This is the ligament which is from the sacrum to the ischial tuberosity, and this ligament from the sacrum to the ischial tuberosity, this ligament, it is called the sacrotuberous ligament. So here you can see this ischial tuberosity to the sacrum, this ligament, it is sacrotuberous ligament. On the just after cutting this sacrotuberous ligament, I will put it on the sides. You can see there is a one muscles which is covered by the fascia. This is a piriformis muscles. This piriformis muscles which is below to it, there is a structures which is passing. It is the inferior gluteal vessels, and now here you can see this is the inferior gluteal vessels, as well as you can see this is the inferior gluteal nerve. And this inferior gluteal nerve which is formed by the L5, S1, S2 ventral rami of the dorsal division of L5, S1, S2, which forms the inferior gluteal nerve, and this mainly supplies to the gluteus maximus muscles. After that, I have reflected the another, it is the superior gluteal uh, nerve and vessels. This is some portion of the gluteus medius which is inside along with the but here you can see this major portions of the gluteus. This is a gluteus medius, and this superior gluteus medius, and deep to this gluteus medius you can see there is another muscles. It is the gluteus minimus. Here you can see this is a portion of the gluteus medius, and this is a this one is a inferior gluteal vessels and nerves. All this thing below to the piriformis, and this is a gluteus maximus. But here this is a gluteus medius, and this gluteus medius, which is supplied by the superior gluteal vessels and nerve. So this is the superior gluteal vessels and nerve. After reflecting this superior gluteus, under beneath it, I will cut it, and here you can see this is a inferior gluteus minimus muscles. So this is a gluteus medius, and this is a inferior gluteus, and this is the superior gluteal vessels, and now innervate to the both gluteus medius and gluteus minimus muscles. So this is a gluteus medius, and after deep to it there is a gluteus minimus muscles. Here over the bone you can see there is a, this is a posterior gluteal line, and this posterior gluteal line behind to it there is attachment of the gluteus maximus muscles as well as the gluteus maximus which is attached to the sacrum, adjoining sacrums. Between the posterior gluteal line and uh, between the posterior and anterior gluteal line, here in this area, there is a gluteus medius, and below to this inferior gluteal line, anterior gluteal line and inferior gluteal line, this area there is a gluteus minimus which is attached. So this portion gluteus minimus, in major portion this is a gluteus medius between the anterior gluteal line and posterior gluteal line. Between the anterior gluteal line and inferior gluteal line there is a gluteus minimus, and behind to the posterior gluteal line there is a gluteus maximus which is attached. Amongst the medius and minimus which is attached to the medius which is attached to the greater trochanter of the greater trochanter of the femur on the lateral aspect, gluteus minimus which is attached to the anterior aspect of the greater trochanter, and gluteus maximus which is attached to the also over the femur on the gluteal tuberosity, as well as the major portion of the gluteal maximus which is inserted on the iliotibial tract. Now we have already identified the gluteus maximus, and it is innervated by the inferior gluteal vessels and nerves. This is the nerve mainly, and this is the vessels. This is the piriformis, and below to the piriformis you can see this is a sciatic nerve, and this sciatic nerve just medial to the sciatic nerve, this is a posterior cutaneous nerve of the thigh, which is innervate to the mainly the skin of the back of the thigh. Major portion of the back of thigh skin innervated by the posterior cutaneous nerve of the thigh, and it is formed by the S1, S2, S3, and this is a sciatic nerve, and this sciatic nerve which is formed by the two component, tibial component and common peroneal component. Tibial component which is formed by the ventral rami of the ventral division of the L4, L5, S1, S2, S3, and the common peroneal division which is formed by the ventral rami of the dorsal division of L4 to S2. L4, L5, S1, S2, it is a common peroneal. Both are united, it makes the sciatic nerve. Mostly it is it come into the gluteal region through the below to the piriformis muscles, and you can see this is a uh, sciatic nerve come inside the gluteal region. It is formed inside the pelvis, and it is come inside the gluteal region below to the piriformis. We have already seen this gluteus medius muscles, and this gluteus medius which is supplied by the superior gluteal vessels and nerve which is formed by the L4, L5, S1, ventral rami of L4, L5, S1, dorsal division, it forms the superior gluteal nerves, and this is along with it there is a vessels, and deep to here you can see there is a muscles, it is the gluteus minimus. Another structure inside the gluteal region, you always remember this is the greater trochanter, and this one is the ischial tuberosity. In between this ischial tuberosity and greater trochanter, there is a below to the sciatic nerve. The muscles are the lateral rotator of the thigh, and this lateral rotator of the thigh, here you can see this is the most upper one muscle. It is the superior gemelli. Along with it, there is a obturator internus, inferior gemelli, and quadratus femoris muscles. Amongst here, just below and medial to the sciatic nerve, uh, at that level, you can see this now to quadratus femoris. This is now to quadratus femoris, which is goes deep to the obturator internus, and it supplies to the quadratus femoris, as well as inferior gemelli, which is supplied by the now to obturator quadratus femoris, now to quadratus femoris. And this now to quadratus femoris, which is formed uh, uh, by the L5, S1 and S2 ventral rami of ventral division, same as the inferior gluteal now. It is the also L5, S1, S2 of the ventral rami of dorsal division, which makes the inferior gluteal, but ventral rami of ventral division, which forms the now to quadratus femoris. While the now to obturator internus, here you can see these are the three structures below to the sacrotuberous ligament and above to the sacrospinous ligament. This is the sacrospinous ligament, and this is the interpudental now, and along with his interpudental artery and veins, and now to obturator internus. So this now to obturator internus, which is formed by the L, uh, L4, L5, S1, and this now to obturator internus, which is also supplies to the obturator internus and superior gemelli, and it is formed by the L4, L5, S1 ventral rami of ventral division, which forms the now to obturator internus. So these are the three structure which is short durations, which is come into the gluteal region through the greater sciatic notch. This is the all is the greater sciatic notch, and again it enter inside the pelvis, and a very short run inside the gluteal region and enter again inside the pelvis through the laser foramen. It is the interpudental nerves, interpudental vessels, and now to obturator internus. So these are the three structure you can see. Most lateral one, it is the now to obturator internus. Along with it, there is a interpudental vessels and nerves, and interpudental nerves. Amongst the interpudental nerves, immediately just medial to the ischial tuberosity, it gives the one branches. It is called the inferior rectal nerves, and there is a beginning of the pudental canal and the pudental nerve and vessels, which is goes inside the pudental canal, and it gives mainly the parasympathetic innervations inside the pelvic structures. So this is about to the uh, gluteal region and muscles of the gluteal region. So hope you understand the structure of the gluteal region, and mainly you have to understand the sciatic bed, which is formed by the lateral rotator of the thigh, and particularly three muscles, superior gemelli, obturator internus, and inferior gemelli, and quadratus femoris. These are the four muscles. Between the medially there is a ischial tuberosity, and laterally there is a greater trochanter. In between there is a sciatic nerve which is passes, and this sciatic nerve into the lower part, which is completely covered by the one muscles. It is the biceps femoris, and the long head of biceps femoris, which is crosses from medial to lateral side, the uh, sciatic nerve. And sciatic nerve, mainly it is lies between the medially semitendinosus and semimembranosus, and laterally biceps femoris. Thank you very much.